Welcome to the Stroger Hospital and Cook County Health and Hospital Systems Training Module number 16. Environmental Cleaning and Disinfection for the Clinical Support Areas of Stroger Hospital. Thank you for taking the time out of your busy work schedule to attend this important training session. Let's begin.
Before beginning the cleaning of clinical support areas, it is vital to understand the importance of environmental cleaning and disinfection of all rooms and areas of Stroger Hospital. Our mission is to remove bacterial contamination from surfaces and equipment where patients receive care, in order to prevent transmission of microorganisms from patient to patient or from patient to staff. Your role as an environmental service worker is critical for the achievement of this goal.
A summary and overview of the topics we will be covering in this training module include the following. Number 1. Examples of the clinical support areas with an emphasis on the similarities and differences from cleaning other areas of Stroger Hospital. Number 2. Interacting with patients and medical staff using the AIDET plus P method. Number 3. Emptying waste receptacles. Number 4. High and low dusting. Number 5. Sanitizing all horizontal surfaces and high hand touch areas. Number 6. Spot cleaning vertical surfaces. Number 7. Cleaning restrooms that are adjacent to or part of the clinical support areas. Number 8. Dust mopping floors. Number 9. Final inspection of your work before damp mopping. Number 10. Damp mopping as your final step as you exit the area. Number 11. Cleaning offices, desks, and workstations that may be inside of or adjacent to clinical support areas. Number 12. Cleaning kitchenettes and break rooms located in clinical support areas. Number 13. Cleaning physical therapy equipment. Number 14. Cleaning the mortuary. Number 15. Cleaning the radiology and other medical imagery departments, and special precaution of that must be taken in the MRI area. And finally, number 16. Cleaning the cath lab.
Let's start with some examples of clinical support areas. Clinical support areas are the places within Stroger Hospital that provide specialty services to patients who are staying in the hospital or who may be receiving services from Stroger Hospital on an outpatient basis. Examples of clinical support areas include physical therapy clinics, radiology clinics, medical imaging departments and MRI rooms, the hospital mortuary, and the cath labs. The differences between cleaning clinical support areas and other areas of Stroger Hospital are that clinical support areas tend to be much busier with a combination of patients from within the hospital and patients receiving services on an outpatient basis. Also, clinical support areas are providing specific specialized medical services to patients such as X-rays and medical imaging, physical therapy, or lab work. For you, the environmental services worker, the similarities in cleaning clinical support areas to cleaning the rest of Stroger Hospital are twofold. First, our goal, as in all our environmental services work, is to provide the highest level of cleaning and disinfection on all surfaces for maximum infection control and minimum cross-contamination. Second, as we perform our work, we must always be aware that we are ambassadors for Stroger Hospital to patients, guests, and medical staff. We only have one chance to make a good first impression, so be polite, show kindness and courtesy, have a positive attitude, and remember, Stroger's acronym for interaction with patients, guests, and staff AIDS plus P and use it each and every time.
Because of its importance, we will now take a moment to review the Stroger Hospital process AIDS plus P and how it guides us in our polite and professional interactions with patients, guests, and medical staff. Before any of these personal interactions occur, however, if the door to the area you are about to enter is closed, always knock first and wait to hear a reply before entering. A stands for acknowledge the patients, staff, and guests. Speak to them directly, making eye contact. Have a pleasant tone of voice. If you notice a name tag, refer to them by their name, using the formal Mr., Mrs., Miss, along with the last name to show respect. If you know that the person you are interacting with is a doctor, refer to them as such, using the title doctor with their last name. I means introduce yourself by name, first and last. D stands for duration, and it means let the patient, staff, and guests know that you will be working in the room for about 15 to 20 minutes, or longer if the room is large, and your duties will take more time. If the patient, guest, or staff asks you to not clean and come back at another time, respect that request and make the necessary arrangements in your work schedule to do so. E is for explain. By letting them know that you are from the Environmental Services Department of Stroger Hospital and that you are there to clean and disinfect the area. T stands for thank you. Be sure to say please and thank you often, and especially be certain to say thank you when you are finishing your work and leaving the room or area. P is for promise. Your promise to the patient, guest, or staff is to take care of any request they might have that you can take care of yourself and that you are authorized to take care of yourself. Examples of such requests would be cleaning a surface or a spill, providing linens, moving a light piece of furniture, or turning on or off a light. Requests that you cannot take care of, or that you are not authorized to take care of, you need to promise that you will report the request to someone who can. Examples of requests you cannot and should not take care of yourself include giving medicine to a patient, giving food to a patient, moving a patient, or requests for repairs to the clinical support room. For these types of requests, you can promise that you will report the request to your supervisor on behalf of the patient, guest, or staff who has made the request to you. Always remember, as a member of the Stroger Environmental Services team, you are an ambassador for the hospital. You have only one chance to make a great impression. Always use it to do your best.
Start by emptying receptacles. To begin your cleaning work in a clinical support area, you will start by emptying the waste receptacles. Before beginning this work, perform hand hygiene and put on appropriate PPE, making sure you put on the correct PPE for clinical support areas. Gloves and your CCHHS uniform are required for all cleaning work that you perform in Stroger Hospital. Note the following additional special PPE requirements, however, that are necessary for each of the following clinical support areas. The cath labs will require that you wear a hair cover and gloves. In special procedure rooms, you will also be required to wear a hair cover and gloves. In MRI areas, you will need to wear the hair cover and gloves. Also, please note that you will need to wear radiation precaution PPE. And finally, in case rooms, you will be required to wear a hair cover and gloves.
With the appropriate PPE in place, next, inspect the area before pulling out trash. This is to help you plan your work by determining which portions of the room need special attention. Pre-inspection also allows you to gather any loose trash and place in wastebasket before waste collection. Please note the following. It is important to remember that in designated special procedure rooms, all washroom trash must first be checked by the Stroger medical staff technician that is on duty before an EVS employee can dispose of the trash. If there is a large amount of waste in a receptacle, do not use hands or feet to compress trash. This is to prevent injury from loose sharps that might be improperly disposed of. Gather trash from the waste receptacle by pulling up on the upper edges of the liner. Lift waste liner slowly out of the receptacle, keeping it away from your body, and carrying to designated container. Remember to keep the red bag medical waste separate from the standard waste. Also, check sharps containers and replace with new empty containers as needed, following all procedures for safe handling. Lastly, wipe the interior and exterior of the waste receptacle and then reline with a new liner.
After emptying the waste baskets, your next step is to perform high and low dusting of horizontal and vertical surfaces. Start with high-level surfaces and work your way down. Make sure to dust surfaces that are shoulder height or higher, utilizing an extension tool when necessary. Be sure to dust vents and the walls around vent openings. Dust ledges, furniture, fixtures, and any other surfaces that need dusting as you work your way down. Remember that all horizontal surfaces, like window ledges, shelves, cabinet tops, and wall chair guards, collect dust. If there is any technical, medical, or lab equipment, such as CAT scanners, microscopes, X-ray machines, dialysis machines, or other electronic or precision diagnostic equipment, do not touch and do not dust and do not clean in any way.
Next step should be sanitizing all horizontal surfaces and high hand touch areas with neutral disinfectant cleaner. Make sure to give the adequate 10 minutes of wet dwell time on each surface you clean. This guarantees the killing of microorganisms to help in Stroger Hospital's efforts at infection control. You must clean all hard surfaces that are frequently touched by human hands, such as the doorknobs, light switches, and side tables. Next, clean all furniture and equipment in the area, along with the vertical and horizontal ledges. When spot cleaning vertical surfaces, use neutral disinfectant cleaner and look for areas that are soiled or need cleaning. Don't forget to clean the inside and outside of waste receptacles after you have pulled the trash, while also checking the walls around the waste receptacle to spot clean as necessary. Spot clean wall fixtures and light switches again, with an emphasis on cleaning the high hand touch areas. Always remember that neutral disinfectant cleaner needs time in order to work effectively, so always allow for the necessary 10-minute wet dwell time for the cleaner to sit on the surface before you wipe it off.
Clinical support areas may have one or more restrooms inside of the area or adjacent to the area. These restrooms may vary in size from a small, private bathroom with only one sink and one toilet up to a large bathroom, locker room with multiple sinks, urinals, toilets, and a large shower area. These larger bathroom, locker rooms are commonly found in physical therapy areas. Whatever type of bathroom is located in the clinical support area you are assigned to clean, you must be ready to provide a complete cleaning and disinfection of any and all bathroom fixtures, surfaces, floors, and walls. Prepare to clean the restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of surfaces and fixtures in the restroom, make sure you are using neutral disinfectant cleaner and orange microfiber wipers. Remember, orange wipers are for bathroom cleaning only. Blue wipers are for room cleaning only, outside of the bathroom. On all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow for the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with paper towel to prevent streaks. Clean sinks and the surrounding areas, such as the counters, underside of the sink bowls, and piping under the sinks. Make sure to spot clean all splash marks on the wall that may be adjacent to the sinks, the toilets, and the showers. If showers are present, clean the showers, starting at the top and working your way down, and being sure to scour the shower basin floors. If shower curtains are present, clean them, being sure to remove any mold or mildew. If any shower curtains cannot be cleaned or are torn and tattered, report this to your Stroger Buildings and Grounds Department for replacement. Next, start disinfecting the toilets by first applying bowl cleaner into the bowl of the toilet bowls and allowing it to sit 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilets, to both sides of the seats, and to all exterior surfaces of the toilets, again allowing for proper wet dwell time. Wipe all surfaces of the toilets down and leave in a clean and streak-free condition. When cleaning the inside of the toilet bowls, use a Johnny Mop to clean the inside and then replace the Johnny Mop in its carry container. Note, do not use the toilet bowl brush or Johnny Mop on the outside of the toilet bowls or any other surfaces other than the inside of the toilet bowls. Remember to empty the bathroom waste cans, taking all of the same precautions used in emptying the clinical area room waste cans. For example, do not compress the waste. Do not let the full waste bag you have pulled from the can bump up against any part of your body. Wipe the waste cans clean and reline with a new clean liner.
Next, let's talk about refilling dispensers for soap, hand towels, and toilet paper, and damp mopping the restroom floors. But first you must stop and remember, you have just cleaned the restroom. Your gloved hands are contaminated with the microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves. Wash your hands and put on new, clean gloves. Once proper hand washing and regloving has been done, you may proceed. Restock paper towels and then fold properly facing downward so that the towels dispense as they are intended to. As your final step in cleaning the restrooms, damp mop the restroom floors.
Now that you have finished cleaning and restocking the bathroom, the next step is to return to the clinical support area room to dust mop the floor. Always make sure you dust mop before damp mopping. This excludes instances of obvious blood spill in the room, in which case it is appropriate to damp mop first. If you enter a blood or bodily fluid spill, use the product SuperSorb in accordance with the product instructions and in accordance with Stroger Hospital's standard operating procedures for cleaning up blood-borne pathogens, which can be found in the Standard Operating Procedures Manual number 24. When dust mopping, make sure you are aware of all foot traffic around you. Work clockwise around the room and use an S stroke while keeping the leading edge moving forward. Be sure to move any furniture and dust mop underneath. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust to become airborne, deteriorating the indoor air quality and resettling dust on the surfaces you have just cleaned. Also, make sure to dust mop thoroughly in corners and along edges. Dust mop the baseboards too. Look behind doors and do not leave any dust bunnies behind.
Final inspection before damp mopping. Before damp mopping, take a moment to inspect your work in the clinical area. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharps container for items that need to be disposed of, and the soap and hand sanitizers to make sure that they are properly refilled. It is also important that you check door hardware and metal kick plates to make sure that they have been properly cleaned. If any items in the room need repair, for example burnt out lights, be sure to report this to the Stroger Building and Grounds Department.
Damp mopping the floors. Prepare to damp mop the floor by making sure the wet floor sign is outside of the door. If the clinical support area room you are cleaning is large, you will need to place 2 additional wet floor signs, one approximately 12 feet ahead of where you are mopping and another about 12 feet behind. Inspect all corners, edges, and baseboards of the room, and if you find them dirty, clean these areas with the mop. Begin damp mopping the floor, working around the room using an S stroke, continuing to pay special attention to corners and baseboards. Make sure to move any furniture and mop underneath. If you find stains, spots, or buildup on the floors or in corners and edges that you can't remove, report this to your supervisor. However, before reporting this, please make sure you have made every effort to remove any spots, stains, or buildup yourself, using your mop or a hand scrubbing tool.
Interacting with patients, guests, and medical staff after completion of your cleaning work. After you have completed your cleaning work, before leaving the area, ask any patients, guests, or medical staff if there is anything else they need and help them in any way you can. Remember to distinguish between requests that you are authorized to address yourself versus those that you have to refer to someone else. Generally, if it is a request that involves cleaning, you can respond directly yourself. If it is a request that involves medical attention for a patient, that needs to be referred to a member of the Stroger medical staff. If it is a request that involves a repair of something broken or not working properly, you will need to report that to the Stroger Buildings and Grounds Department. After you finish, be sure to say thank you and leave the clinical area.
Special instructions for cleaning offices, desks, or workstations that may be located in the clinical support areas. You may find desks, cubicles, private offices, conference rooms, or other office furniture, fixtures, and spaces inside of or adjacent to clinical support areas. When you do, it is your responsibility to provide basic office cleaning services to these areas. When cleaning offices and workstations, before starting, perform hand hygiene and put on new, fresh gloves. Dry dust desktops and other horizontal surfaces using a dust cloth to remove dust. Also, periodically high dust using an extension tool to remove dust from vents and other high-level surfaces. Use neutral disinfectant cleaner to clean all office and work areas, including desks, tables, file cabinets, chairs, phones, and headsets. If any desks are labeled that they are to be cleaned and papers have been moved off to the side, then clean the entire desktop surface area, making sure to thoroughly clean phones, headsets, and chairs. If instead papers and files are left out on the desk, do not move or disturb these items. Instead, dust and clean around them, being sure to minimize the extent to which you move or disturb the position of papers and files. Clean fabric chairs with a vacuum or brush. Clean plastic or vinyl chairs with a neutral disinfectant cleaner. Vacuum carpeted areas, paying special attention to vacuum out corners and edges as needed. Dust mop vinyl tile or other hard surface floors. Following up with damp mopping as your final step.
Special instructions for cleaning kitchenettes and break rooms. You may find that there is a small kitchenette or break room in any of the clinical support areas you are assigned to clean. If so, your duties will include cleaning and disinfecting this area. As always, begin by performing hand hygiene by washing your hands and putting on fresh, clean gloves. Use neutral disinfectant cleaner to clean all office and work areas, break rooms, and kitchenettes, and as always, allow the proper 10-minute wet dwell time. Clean and disinfect all drinking fountains, paying special attention to the splash guard, cleaning underneath and the splash guard itself. Clean the exterior and interior of all microwaves with neutral disinfectant cleaner, and wipe down the exterior of all refrigerators. If there are any sinks in the kitchen area, be sure to clean and disinfect them along with the counter area surrounding the sink. If there are paper towel dispensers, soap dispensers, or hand sanitizer dispensers, replenish each dispenser before exiting the area. Be sure to dry and wet mop all hard flooring areas and vacuum any carpeted areas, being sure to pay special attention to corners, baseboards, and edges.
Special instructions for cleaning exercise and physical therapy equipment. Your services in physical therapy areas will be similar to cleaning a health club or gym. Because patients are oftentimes perspiring in these areas, it is important to clean them thoroughly to prevent bacterial contamination from body sweat. Also, because physical therapy involves a lot of handheld exercise equipment, there are many high hand-touch surfaces to clean and disinfect. For any exercise and physical therapy equipment, use neutral disinfectant cleaner to disinfect all surfaces, especially the high hand-touch areas. Remember to allow the required 10-minute wet dwell time. Also, be aware that in addition to the high hand-touch areas, patient's perspiration will drip down onto the lower surfaces of the equipment and the floors surrounding the equipment. Pay special attention to clean in these areas too. Be sure to clean all vinyl, padded, and rubber floor mats with disinfectant cleaner and refill any and all hand sanitizer stations. If you spot used linens or towels in the area, place them in the collection bins and replenish all towels from the towel station. Be sure to dry and wet mop all flooring and vacuum any and all carpeted area in the physical therapy and exercise areas. If there are mirrors or other glass surfaces, clean these and leave them in a streak-free condition.
Special instructions for cleaning the mortuary. When cleaning the mortuary, apply a generous coat of neutral disinfectant cleaner on each surface you are to clean. Allow 10 minutes of wet dwell time to allow the disinfectant to kill harmful microorganisms. It is vital that you remember to wear the proper PPE and use the designated disinfectant in order to prevent the spreading of microorganisms. If there are any open remains left out in the mortuary when you are cleaning, contact your supervisor immediately, as the handling of remains is the responsibility of the medical staff. If you come across any bodily fluids or blood on the floor or hard surfaces, Please adhere to the full safety and cleaning procedures for the cleanup of bloodborne pathogens, as described in the Stroger Hospital Training Module number 24, Cleaning of Blood and Bloodborne Pathogens. Perform high and low dusting as needed by appropriately looking for surfaces that may accumulate dust and wipe them down. As a final step, dust mop all hard flooring areas, followed up with damp mopping. Always pay special attention to detail cleaning of corners, baseboards, and edges when performing both dust mopping and damp mopping.
Special instructions for cleaning radiology and other medical imaging equipment rooms. When cleaning the radiology and other medical imaging departments, there is absolutely no use of electronics or electrically powered equipment. Do not, under any circumstances, bring any electronics, including electrically powered cleaning equipment, into these areas, such as the CAT scan room and the MRI room. No vacuum cleaners, no floor scrubbers, no carpet extractors, no personal electronics such as cell phones or radios. Additionally, do not bring any metal objects into rooms containing CAT scan, MRI, or other magnet-based medical imaging equipment. Look for the sign alerting you to prohibiting metal objects in the room that houses the CAT scanner or the MRI machine. This sign is depicted with a picture of a large horseshoe-style magnet with the word "Warning" in large red capital letters. When you see this sign, never enter the room with any metal objects. As a final and most important precaution for your personal safety, CAT scan and MRI equipment is harmful to people who have heart-implanted pacemakers. If you have a pacemaker or other medical implanted devices, inform your supervisor, and under no circumstances should you ever enter a room with a CAT scan or MRI machine.
Special instructions for access into the MRI area. The Stroger Hospital MRI area is divided into 4 zones. Each zone has increasingly restricted access. Zone 1 is the hallway outside of the MRI area. This is an all-access zone that can be entered by any member of the Stroger EVS team. Zone 2 is the first desk waiting area where patients come in and wait until they are called in for their MRI work. This too is an all-access zone that can be entered by any member of the Stroger EVS team. Zone 3 is the ID access area. Any EVS employee who is assigned to perform work in Zone 3 must first have gone through a pre-screening process administered by Stroger Hospital that clears the EVS worker for safe access into this area. Zone 4 is a restricted area. In addition to having the proper screening and ID badge, any EVS worker must be accompanied by a Stroger MRI technician in order to enter the Zone 4 area. Never attempt to enter the Zone 4 area unaccompanied.
Special instructions for cleaning the cath lab. In the special procedure rooms of the cath lab, EVS employees must wear special garments and PPE, such as gloves, hair and beard covers, gowns, and shoe covers. Additionally, be aware of switches and switch pedals on the cath lab equipment, because depressing a switch or pedal can turn on the radiation utilized by this equipment. Lastly, EVS employees must provide prompt response to cleaning requests and quick turnaround time in the event of STEMI cases.
That concludes training module number 16, Cleaning and Disinfecting Clinical Support Areas. We truly hope that this module has been helpful and informative. If you have any questions, be sure to ask your supervisor for guidance. Thank you for your work at Stroger Hospital and the Cook County Health and Hospital System.